So when you hear the word fibroid, we have two types of patients coming to us with fibroids. One, where the patient has gone and got a routine general health checkup done and the ultrasound has shown the presence of a fibroid within the uterus and they don't have any symptoms. And the other type of patient who comes to us with complaints of fertility problems, that is inability to conceive naturally, with heavy menstrual bleeding, pain during periods, chronic lower abdominal pain, fullness in the abdomen, increased frequency of urination are few of the symptoms the patient may come with, where we diagnose that they have a fibroid or they come to us with diagnosis of a fibroid. In both these situations, whether the patient has symptoms or no symptoms, the patients are worried about this condition. So let's break down what this fibroid condition is and the scientific way to handle this situation. Fibroids are non-cancerous masses growing within the uterine wall. They contain muscle and fibrous tissue together and they are usually round in shape. And to highlight, they are 99% of the times non-cancerous. Why do they happen? We really don't know. It is said that maybe there is a genetic basis for fibroids. Maybe there is a family history of fibroids. Fibroids, how are they diagnosed? They are diagnosed based on suspicion, symptoms. We do an ultrasound. Very important to do a good 2D, 3D ultrasound so that we can know what is the size of the fibroid, position of the fibroid, because fibroids can be in the muscle of the uterus, can be on the surface of the uterus, can be within the uterine cavity, based on which these fibroids are called submucous, intramural or subserous fibroids. So based on the patient's symptoms, based on the number of fibroids, size of the fibroids, 3D reconstruction, what we are seeing, based on the patient's desire for fertility and the age of the patient, we may suggest to the patient just a wait and watch approach where we just observe the patient and keep calling the patient back. We may give them hormonal pills, or we may suggest a myomectomy, which is a laparoscopic surgery where these fibroids are removed, or we may suggest hysterectomy based on the entire case analysis.